It's a pleasure to be here with Dr. Birgit Rakel, who is many things at Thomas Jefferson University. She's on the faculty of the Department of Integrative Medicine and Nutritional Sciences, and one of the lead physicians in the Marcus Institute of Integrative Health from the beginning. She runs the Women's Health Program, and she's co-director of the Fellowship in Integrative Medicine, which is a unique opportunity to train physicians who want to become board certified in integrative medicine. She's taught many programs. She was the leader of the Healer's Heart program at Jefferson. She's been part of the fabric of everything in the department and the institute. So it's really a thrill to have you here, Dr. Rakel.
Thank you.
So Dr. Rakel, what thrills you about integrative medicine?
What thrills me about it is that as you said, there's so many facets, so many things we can incorporate. I think at the base of integrative medicine is medicine, and all of us are trained as conventional physicians, but we're trying to increase our toolbox. And the toolbox becomes bigger with what we do with an integrative approach. Integrative medicine means we're incorporating botanicals, homeopathy, nutrition, traditional Chinese medicine, and Ayurvedic concepts into the conventional medical model.
Can you give me an example in your clinic of how this integrative model really works?
Because I do a lot of women's health, I think what's really important, or what springs to mind is, of course, many of the menopausal women, and there's one in particular that I've been seeing now for about a year. Someone who has menopausal symptoms, difficulty with sleeping, anxiety, some components of depression, hot flashes. So what we gradually worked on were, after doing extensive blood work, looking at hormonal levels, nutritional deficiencies, and then starting to incorporate hormone replacement, incorporating a change in diet, incorporating supplements that could assist in sleep, and mind-body practices. What I've incorporated a lot is the mindfulness training, because we have a fantastic mindfulness program. So this patient also did a mindfulness-based stress reduction course. So the combination of these things a year later, this patient is feeling so much better. And she's been one of the people sending me a thank you note saying, I couldn't have imagined a year ago that I would feel that good.
I think the average person thinking about these different components might not be intuitive why they're so important for reversing some of those symptoms and getting the person feeling well again.
Right.
Could you help us to understand some of those different components, why they're so important to address? Like you started with diet, for example.
Yeah, I would say, a lot of people, when they come in, their diet isn't that great. And cleaning up their diet is a really important part of what I do. So, for example, in this patient, changing her from drinking caffeine, which kept her awake, to changing over to green tea, which also has other components that are really important, as an anti-inflammatory, for example, changing her away from red meat and increasing her diet to more green leafy vegetables. So she had better gut health, which also helps, of course, with menopausal symptoms. We know that the gut microbiome is really important in treating women with menopause.
Yeah, I don't think most people understand that there's a gut connection to something like menopause.
Yeah. Right. And there is, and therefore looking not only at biomarkers like the hormones, but also looking at changing the diet.
Some of the mind-body interventions and reducing stress, how does that help?
In menopause, there is definitely an activation where patients wake up at 2:00 in the morning. It could be dietary, blood sugar could play a role, but also cortisol levels are high. So when we can work with mindfulness-based stress reduction techniques, what that's going to help is give people a tool where breathing techniques or even visualizations like the body scan can put them into a better place and help them all in all feel better or, less stressed.
I'm sure there's a lot of women out there that might be listening to this or hear this. Be your top couple of things you would want them to know.
One thing I didn't mention is exercise. I have a tripod. I have a little model in my practice. It's a little triangle that has some stones and corals in them. And what I always say, it's at the bottom of a tripod, which is very, very stable. It's diet, exercise, mind, body. So if there's 3 things that, a patient can do on their own without even seeing me, it's using exercise, even if it's starting with 10 minutes, changing your diet to, I would say, Mediterranean diet is always what I recommend. And I have cookbook recommendations and handouts. And then mind body could be mindfulness-based stress reduction or yoga. So these are the foundations. And then from that foundation, we can work with supplements and if need be with medication. So integrative medicine is not alternative medicine. We're not pushing away conventional Western medicine. What we do, we incorporate the best of both worlds.
Why was it important for you to lead the charge in creating such a unique fellowship program?
I'm not going to live forever. I'm not going to be around forever, but I'm so passionate about integrative medicine. To know that the next generation of physicians is created through this program is such a delight. We've already graduated amazing, amazing physicians who are now at institutions that are, some of them are here, some of them have gone to other institutions. I really want the term integrative medicine to no longer exist so that we can say we have medicine. I really want that we have good medicine and that more and more students and fellows and other physicians know that what we're doing is so important.